At ATS, we have a 5-point program that addresses your needs related to your addiction. First and foremost, we need to make sure that medically you're okay. Most of our patients come here needing some level of detox, either from an opiate or alcohol or benzos. Consequently, our physician is involved shortly after our therapist does a comprehensive substance abuse history and gets some mental health background for the individual patient. We also need to know if you're being treated by another physician for some other condition. Most of our patients do have other physicians who are treating them, perhaps anxiety, depression, bipolar, anorexia. So some of our patients have other physicians for whom we need to coordinate a treatment plan. If the primary problem when they come to us is an opiate condition or an alcohol condition, we're certainly aware that those patients need to be detoxed safely. So we work with our physician to look at, if it's an opiate condition here, our physician generally uses what's available to him, and our physician characteristically utilizes the current effective medication to address an opiate condition, which is Suboxone or naltrexone or one of the other medical possibilities that's available to him. Most of our patients who are on an opiate or have an addiction problem and present as an opiate addiction will be on some type of medication to decrease the cravings and the compulsion to use that medication, so that we can get them off of using an opiate, get them onto a medication, and we can slowly detox or decrease their dependence on that medication. But it takes an appreciable length of time, and this has to be managed by a physician. So that also occurs for our people who are on alcohol as a primary drug of choice and substance. So our physician has available multiple medications available to them to use or detox people from alcohol. The two most dangerous substances that we deal with regards to withdrawal is not an opiate, like some people believe. It certainly is alcohol or benzodiazepines. Both of those medications, if withdrawn from quickly, can cause seizure activity. Consequently, those are the ones that we need to monitor the most carefully. So we have available medications to assist our physician and slowly titrating patients from those medications, and then we get involved with the other underlying causes through weekly visits with our therapist and physician to coordinate a plan of care to address other conditions, which may be anxiety, depression, bipolar, or some other mental health condition that has contributed to the use of substances that must be treated simultaneously. One of the problems that we have dealt with in the past related to medical intervention for patients is that we have a medical intervention that deals specifically only with the drug of choice and doesn't deal with the underlying cause. So as we address the need for the substance use disorder, the demand for that substance decreases, but their anxiety, depression, bipolar increases. That's called a co-occurring disorder. So all of our patients are treated for co-occurring disorders if that's what they have here, because as one particular symptom decreases, the other one is most likely going to surface, so they have to be treated simultaneously. That takes an appreciable amount of time. Consequently, our patients have available the services or use of our physician